An independent review of the Personal Independence Payment Assessment. Overview of findings. Number 1. The current Personal Independence Payment (PIP) process gives a disjointed experience for claimants. Some short-term improvements are needed, for example, to communications, including decision letters. In the longer term, there should be a more integrated, digitally enabled claims process under common branding that would improve claimant experience and effectiveness. Two, the way in which further evidence is collected can be clarified and improved. PIP is an assessment of functional impact, yet it is widely perceived as a medical. Health professionals, other than general practitioners, GPs, are often well placed to provide relevant further evidence. The potential for sharing information already held by the department and across the wider public sector should be explored. Three, it is too early to draw definitive conclusions about the overall effectiveness of the PIP assessment based on available published data. A rigorous evaluation strategy that will enable regular assessments of the fairness and consistency of award outcomes should be put in place, with priority given to the effectiveness of the assessment for people with a mental health condition or learning disability. Planning for the introduction of PIP. 4. PIP retains some key features of Disability Living Allowance, DLA. Like DLA, PIP is not means-tested, is non-taxable and non-contributory. Is intended to provide financial support for disabled people with the greatest challenges to remaining independent. Is payable both to those in work and out of work, and has two components, daily living and mobility, with different levels of award for each based on the assessed level of need. 5. PIP was planned in the context of fiscal austerity and followed a 30% increase in DLA caseload over the previous 20 years. Intended shifts from DLA were a move to a more transparent and objective assessment of need, with assessments by health professionals employed by contracted providers. A stronger emphasis on assessment of the functional impact of claimants' underlying disabling and medical conditions, not the conditions themselves. A points-based system to assess eligibility for awards. More regular reviews of eligibility for those receiving awards. And a greater focus on the needs of claimants with mental health conditions. Six, the assessment criteria are central to the PIP assessment and were subject to lengthy consultation and testing. There are 10 daily living activities and 2 for mobility, with points-based scales for functional impact. This review has focused on whether they are being appropriately applied. Early stages of PIP. 7. The early implementation of PIP from April 2013 has focused on new claims and more recently a smaller proportion of natural reassessments for DLA recipients. Managed reassessment for the majority of DLA recipients is scheduled to begin from October 2015. This will be the most challenging phase, with long-term recipients of DLA invited to claim PIP. Assessments and decisions for the early claims have taken longer than expected, resulting in very long delays for many claimants. 8. Addressing these delays through increased resourcing and other measures has been the main focus during 2014. Revised arrangements to fast-track claims under special rules for terminally ill people are working well. The recovery programme for other claims, the great majority, remains underway, and the government plans to publish data on clearance and waiting times from March 2015. (9) The latest published data on PIP awards at the time of publishing this report were to July 2014, when 106,400 were in payment. Some 55% of new claims have received an award. This is higher than originally expected. The Office for Budget Responsibility is now projecting a higher success rate for new claims than the original forecast. Around 75% of existing DLA claimants are expected to receive a PIP award. This information is from Personal Independence Payment Reassessment and Impacts, Department for Work and Pensions, December 2012, Table 2. This information is available at (10) Data so far available is insufficient to draw meaningful conclusions about the composition of PIP awards. Views expressed during the review. 11. The formal call for evidence had a high response, particularly from people who had claimed PIP or supported claimants. The overriding theme, also reflected in other inputs to the review, was the impact of delays and backlogs, with a particular frustration from claimants about knowing the status of their claim and how long they would need to wait. Delays in receiving awards have had an impact on claimants' financial position, including the knock-on to passported benefits linked to PIP. Another strong theme from all groups was concern over the quality of decision award letters. 12. Other main areas where comments were received from claimants and their representatives were the complexity of and time taken to complete the PIP2 claim form, mixed experiences of the actual face-to-face assessment, including a lack of transparency, difficulties with appointment logistics, and views that the impact of fluctuating conditions and mental health conditions may not be being appropriately addressed. 13. In addition, inputs received from DWP staff, assessment providers, and others highlighted constraints posed by different IT and associated systems. Some positive feedback from health professionals about involvement in PIP assessments, but some concerns about the degree of engagement with case managers, a view shared by DWP staff. Areas of dissatisfaction with the arrangements for collecting further evidence, and concerns about the number of appointments lost through non-attendance by claimants.